Kearney with PHM International and publisher of the PHM Emerging Markets Healthcare Monitor. This is our Q4 2012 update, Eyes Wide Open. In the fourth quarter of 2012, we saw that Hungary, in particular, and the Balkan states in general, continue to have trouble with loan repayments. Now, the challenge here is that private healthcare is definitely impacted when the consumer base is struggling with their loan repayments. So we see this to continue for quite some time, well into 2013. In Indonesia, the fourth quarter of 2012 saw an uptick in activity in the hospital sector in terms of developers and investors. And we actually find this to be a bit of a challenging market for one reason, and that's geography. Indonesia is the world's largest Muslim country, but it's also made up of over 170,000 islands, 6,000 of which are inhabited. So 6,000 islands compared to 170,000 seems like a good number, but it's still 6,000 islands to spread any type of hospital development program across. So Indonesia's growing middle class is certainly a positive. We see a few hospitals being able to develop in the private arena, but by and large we think Indonesia is going to remain a public government health environment. In the fourth quarter of 2012, we saw China as a bright spot for one area in particular, and this was Roche Pharmaceuticals and their venture with SwissRe, the reinsurance company. Now, what they've done is they've created health insurance policies, essentially dread disease policies, to finance the payments for pharmaceutical drugs at the patient level. These policies are really positive for a couple of reasons. One is that it does create a financing mechanism for Roche products. If you have coverage for cancer, you're going to be able to use that particular policy to pay for Roche pharmaceuticals. The other positive is for SwissRe, and that is because of the nature of dread disease policies. These policies are essentially cash cows in the industry. And the reason for this is this. The policies only cover the stated disease. So if you have a policy that covers, let's say, cancer and you develop diabetes, that particular policy will not pay for the diabetes treatment. So we really like dread disease policies from a health insurance standpoint. They're low cost, high value, and they're widely accepted in the consumer market. We think it's a great deal for China, Roche, and SwissRe.